Good morning, everybody. Thank you very much for coming to my talk, and thank you to the organisers for inviting me to speak. I'm going to be talking to you today about the recommendations for the conduct of systematic reviews in toxicology and environmental health research, COSTER, which is a new standard for conduct of systematic reviews. For those of you who don't know me, my name is Paul Whaley, and I'm a researcher and consultant based at Lancaster University in the United Kingdom. I'm also a research fellow at the Evidence-Based Toxicology Collaboration at Johns Hopkins Bloomberg School of Public Health, and I'm Systematic Reviews Editor at the journal Environment International. I do research into good practice in conduct of systematic reviews, evidence mapping methods, and improving publishing standards for scientific research. Environment International is the journal that is publishing the WHO EMF systematic reviews that Emily has been talking about, and that's where I'm the editor for systematic reviews, and I'm supported for that specialty by a fantastic team of guest editors, Sharat Ejaz at Bristol, Sarah Dreesen at Aachen, and Jean-François Doré from INSERM. These are my interests. The most important are my personal fees from Elsevier as a systematic reviews editor for Environment International, where COSTER was published, and my receipt of grants from Lancaster University and in-kind support from the Royal Society of Chemistry for developing COSTER. So today I'm going to be talking to you about four things. Firstly, what is COSTER and why is it needed? Secondly, how was COSTER developed? Thirdly, how to use COSTER as a research standard to help you conduct high-quality systematic reviews. Fourthly, I'm going to go through some common discussion points and frequently asked questions about COSTER, how it was developed, and its role as a research standard. I hope you enjoyed the talk, and if you have any questions, please pop them in the chat box because I'll be monitoring that whilst I'm speaking to you now. So, our first question, what is COSTER? Fundamentally, it's a recipe for conducting environmental health and toxicology systematic reviews. COSTER makes 70 expert recommendations for conducting a systematic review, and it's intended to help researchers produce good, solid, scientific systematic reviews. So these would be reviews that address some important research question, that they are transparent about the methods that they use and the way they present their results. And the results of the systematic reviews should also be valid. It basically sets out in a certain amount of detail what a research team should do if they want to do a systematic review which is authentically systematic. So to show you who was involved in writing this, this is my list of co-authors on this page. It was a huge group effort, a lot of work from a lot of people. It was funded and supported by the Royal Society of Chemistry, by Lancaster University, by the ESRC and EPSRC UK research councils. We have a link here at the bottom which I can paste into the chat box, which will take you to the manuscript. The reason that I'm here, of course, is that COSTER is one of the standards and frameworks that is a reference point for the forthcoming WHO EMF systematic reviews. So the WHO EMF systematic reviews are following the same processes as the WHO ILO Burden of Disease from Occupational Environmental Exposure systematic reviews that you may have already heard about this year, which were groundbreaking in their use of protocols and the rigour of their systematic review methods. The rigour of approach led to the discovery that long working hours are the largest attributable cause of workplace mortality, so that's bigger than injury and air pollution, and an early draft of COSTER informed these systematic reviews. And the follow-up WHO EMF systematic reviews are going to be using similar methods. So our second question is, why is a standard like COSTER even needed? And the reason is there is a need for authoritative guidance in the face of conflicting advice about how to do systematic reviews. As a reminder of what systematic review is, it is a methodology designed to minimize bias and error in the process of using existing evidence to answer research questions, and it consists of a number of well-defined steps that ensure the results of a review are objective and transparent. Systematic reviews are arguably the most reliable, transparent method for synthesizing existing evidence when they have been done well, and they're increasingly relied on by national and international agencies for characterizing health effects of environmental exposures. There's currently a wide range of different types of guidance being used in environmental health systematic reviews. A number of frameworks, such as the SIRENA framework for systematic review of endocrine disruptors. There's the navigation guide, which is kind of a conventional systematic review methodology. There's the TOSCA handbook for systematic review. There's MOOSE. There are handbooks, such as the NTP OHAT handbook for conduct of systematic reviews, and then there's the forthcoming IRIS programme handbook. There are standards for healthcare systematic reviews, such as that by the Institute of Medicine and the Cochrane-Messier standard. There are guidance documents by the Texas Commission on Environmental Quality, the European Food Safety Authority, the Australia NHMRC, and lots of people refer to reporting standards for conduct of systematic reviews as well, such as the PRISMA standard. The problem with current guidance is that it's not collectively consistent, so one handbook or guideline will tell you something different to another. Some are more comprehensive than others. Some are more prescriptive than others, saying you must do this, or some saying you should do that. Some recommend practices of dubious validity, which may not actually be systematic. Some developed for specific regulatory purposes, for example, and some aren't actually conduct standards at all. They're reporting standards that tell you how to write up a systematic review, but they don't necessarily tell you what you should do in order for that review to count as being systematic. None make explicit for the environmental health research context specifically what are good systematic review practices. So if you're an environmental health researcher and you're asking which guidance you should choose, how do you know if any one of these is consistent with evidence-based practices? And the need for a standard becomes more urgent as we realise just how many systematic reviews are now being published. So there were none at all, really, before 2005-2006. By 2016, 750 odd were being published a year, and this is when we initiated the COSTER process. And the number of systematic reviews has more than doubled since then, in just 5 years. What we therefore wanted COSTER to do was to provide the environmental health community with authoritative recommendations for conduct of systematic reviews which are consistent with evidence-based methods. And we wanted this to act as a benchmark document against which frameworks and handbooks and so on and so forth can be compared. Basically answering the question, what do I need to do in order for my review to be systematic? So on to our next question, how was COSTER developed? Well, we used a consensus process with a representative group of environmental health systematic review stakeholders to define the recommendations. So what's the consensus process? By consensus, and you want to take a deep breath here because it's a long one, we follow the ISO definition of general agreement characterised by the absence of sustained opposition to substantial issues by any important part of the concerned interests and by a process which involves seeking to take into account the views of all parties concerned and to reconcile any conflicting arguments. For COSTER to be successful, we had to engage a diverse group of environmental health systematic review stakeholders. So we engaged methodologists, practitioners, users and impacted groups of systematic reviews, covering academia, agencies, so organisations like the European Food Safety Authority, the National Toxicology Programme, representatives of industry, representatives of environmental NGOs. And we tried to make sure there was a good balance of disciplinary expertise across that group of epidemiology, risk assessment, systematic review and so forth. Because we needed the views of NGOs and industry and academia to be taken into account in defining what counts as a good systematic review in general, because we wanted it to be acceptable to different groups, and we wanted to be confident that we were setting a standard that different users could potentially meet, we addressed potential bias by balancing interests across the stakeholder group. So we wanted representation of different stakeholder groups. We weren't looking to exclude particular people because of particular interests they might have. We convened the stakeholders in a face-to-face one-day workshop in 2016, and we seeded the consensus process with a discussion draft set of recommendations. This draft was compiled from Cochrane-Messier and IOM standards for conduct of systematic reviews. These are well-considered, well-conceived, well-regarded systematic review standards that we felt would provide a solid, comprehensive base for adapting for the environmental health context. And we discussed each draft recommendation from the discussion draft in parallel breakout groups before reconvening the groups in an extended consensus process. For each recommendation, we asked the groups to consider 3 questions. Firstly, should the recommendation be included in the final set of overall recommendations? Secondly, does the recommendation need to be adapted for the environmental health context? And thirdly, are there any missing elements? And if so, how should they be formulated? Here we have what each breakout group was presented with. So you have a list of all of the draft recommendations, a space for explanatory notes if those were needed, so the participants understood what the recommendation was about if need be, if it wasn't self-evident, and then there'll be points flagged for discussion, so the facilitator could draw the attention of each of the participants to some important issue that may be specifically useful for adapting the MASIR and IAM standards to an environmental health context. We then organised an extended series of follow-up webinars and email discussions to pin down any remaining consensus points that were left over after the workshop. These were actually plentiful. The webinars ran up to June 2017, the email discussion ran up to January 2018, and then by mid-2019 we finally had a manuscript that was drafted. There were then 3 rounds of detailed peer review of the journal, which resulted in significant changes to the framing of the recommendations, though no changes were made to the recommendations themselves. Previous versions of the manuscript were posted on Zenodo for transparency. The end result is we had 20 people involved in developing the COSTER standard, and COSTER consists of 70 recommendations for the conduct of systematic reviews in toxicology and environmental health research. The workshop itself had 31 participants, but because of the length and time of the consensus process following it up, not all were able to participate in that and then develop the manuscript. No participants objected to the publication of COSTER, so the ones who had to withdraw did so for personal or professional reasons, but weren't opposed to the publication of the standard. And we ended up with 70 recommendations across 8 performance domains. Here we have a summary of the domains, so you can see that the planning methods and preparing protocol component of the systematic review process has the most recommendations. This is probably unsurprising given this is where all the methods are accounted for, and the methods for a systematic review are quite detailed. So the process for planning, searching, selecting data, for defining the research question, for defining eligibility criteria, have a lot of recommendations. And then there are a certain number of recommendations for each of the subsequent steps of searching for evidence, selecting relevant evidence, extracting relevant data from included study reports, appraising the validity of included studies, synthesizing evidence, interpreting results, and drawing conclusions. What you will find in the COSTER manuscript are the 70 recommendations for conduct of systematic reviews, so that covers each stage of the systematic review process, and you will also find an explanation of why those recommendations are being made and what those recommendations actually mean. So if you, for example, not clear on why potential conflicts of interest are important to manage systematic review and how they should be managed, then the explanatory document will give you some account of the reasoning behind the specific recommendations that COSTER has made. So our next question is, how do you actually use COSTER if you're doing a systematic review? Now, some people might view these things as checklists. I like to think about COSTER as being more like a recipe book that you follow one step at a time as you're trying to put together the ingredients and mix it up and then bake your systematic review, so to speak. If you're presented with COSTER, so you look at the manuscript, which is pretty long, it's like 14,000 words, and you look at your list of 70 items and the big explanatory document, you might be starting to think, oh, I may be a little overwhelmed here. Well, it does sound like a lot, but on the other hand, systematic reviews are pretty complicated projects which involve a lot of steps, and COSTER tries to provide comprehensive guidance for each of those steps, so it is going to end up inevitably being a pretty long list of things. However, if you think about a systematic review being a project that takes, say, 3 months to plan, 70 items over 3 months is maybe not so much. That's not even an item a day, and it's really not too bad if you take it step by step. And there are some other things that we're developing to try to help people use COSTER. So what we've done is put a template on the website protocols.io, where we've created a generic COSTER compliant systematic review protocol, and protocols.io's website takes you through each step of the process to help you ensure you've met each recommendation, and it helps you fully document your plan methods. So we think that's kind of a useful tool, and we're working on version 2 of that generic protocol at the moment. If you have any questions about that, I'll be more than happy to demonstrate this for you at another time, just arrange a call with me or something. One of the things that came up both in the process of developing COSTER, which we're aware of, but was reinforced by the peer reviewers, is that when people find a standard, they do sometimes like to say that they have complied with the standard as a way of appealing to some sort of external authority that makes their research sound more credible. Obviously, this is a process which is open to a potential abuse, either deliberate or inadvertent, as it's a mechanism for artificially elevating a reader's perception of the quality of a piece of research, right? So we don't want COSTER to be used in that way, obviously. What we would rather is that people show compliance with COSTER via documentation of which steps were and were not followed, right? Rather than just sort of blandly stating that COSTER was followed in the conduct of systematic review. So we do provide some examples of better language in the manuscript, and we really hope that people will pay attention to the detail of COSTER, not just kind of hold it, hope they followed it, make some empty claim that they did. This is really not the intent at all. In a way, I guess what that does is it brings us to our discussion points about COSTER. There's a number of points of interest, I think, in how we either adapt the methodologies of systematic review to the environmental health context. I think there are a few places where we move the needle a little bit on systematic review. So what I'm going to do now is discuss some of those issues in a bit more detail. I think there are 9 areas in which COSTER makes recommendations which either relate to practices which are relatively uncommon for environmental health systematic reviews, or it develops and clarifies general good practice in systematic review, whatever your topic. I'm going to concentrate on 2 of them here. So we've got the protocol publication practices, and we have the assessment of internal validity of included studies. With regard to protocol publication, it is still very uncommon for environmental health systematic reviews to be accompanied by a pre-published protocol. COSTER recommends a 2-stage process for handling protocols as a researcher. It firstly recommends that you register your protocol, and then it recommends that you formally publish it. So registration is familiar to quite a lot of people who do systematic reviews. So what you would do is you have a document that you upload to a systematic review registry like Prospero that shows you have intent to conduct a systematic review. Now, Prospero registrations rarely provide enough detail for transparency. They aren't peer reviewed, right? And it's unclear what impact registration alone has on the validity of proposed systematic review methods. So what COSTER recommends is a publication process. And here the word publication, we're probably paying a little fast and loose with it. What we mean is that a systematic review protocol should be externally peer reviewed before the systematic review is conducted. Now that might be peer reviewed, then posted on a preprint repository, or peer reviewed and then you'd have a very detailed protocol being put up on Prospero. But the idea here is that you use the peer review process to provide methodological checks on the choices being made by the systematic review team. And this is because peer review of methods before the conduct of a study or a systematic review results in better project outcomes. And this is the process that the WHO EMF systematic reviews are following. So what they're doing is they're submitting their protocol, so their methods, prior to conduct, to us at Environment International, where we triage the protocols for compliance with our systematic review standard. If we find any shortcomings, it's returned to the authors for revision before we then put it to peer review. If a protocol passes triage, it goes on to peer review, and the peer review process improves the manuscript or the protocol to the point where the reviewers are happy to accept it, and then we accept it as a journal. The systematic review teams then do the systematic review and they submit their final manuscript. And at that point, what the editors and peer reviewers do is check the systematic review team adhered to the planned methods and have appropriately presented and interpreted their results. And if all's good, then they accept. Finally, the point of interest is the assessment of internal validity of included studies. What we did in COSTER was we stipulated risk of bias assessment because we didn't want bias in included studies being transmitted through to the findings of systematic review. And this is a really fundamental component of systematic review methodology that distinguishes it from straight meta-analysis. What we didn't do was specify a qualitative domain-based approach. And this is surprising to some people, including some of the reviewers and some of the users, because this is the current state of the art of systematic review. And if I was doing a systematic review right now, and the systematic reviews that Emily is overseeing are doing this, would be to use a domain-based approach for assessing risk of bias. What we were quite cautious about was we didn't want COSTER to sort of hard code or imply that other approaches of equivalent validity were somehow not systematic. So what we wanted in COSTER was to provide some leeway for people to be creative about how they meet the standard, but not necessarily be so prescriptive that if someone came up with a new way of meeting the standard that was systematic, COSTER would somehow inadvertently say that that approach was not systematic, because that's not what we want. We want people to be able to be systematic in exciting new ways, not restrict what they do as researchers. So what we do is we specify transparency, and that risk of bias estimates should be grounded in evidence, and that they should be conducted against clear criteria specified in the protocol, and ensure that study limitations are not mischaracterized. But however a research team wants to do that, it's really up to them. So finally, I can see that time is ticking down, so we come to the last section of this presentation, where we address frequently asked questions, and these are things that people often ask and want clarifying. I'm going to do one frequently asked question, which is, why does COSTER only consist of recommendations which are mandatory? Now, this did kind of divide the peer reviewers a bit. They were like, well, what's the point of recommendations in a standard? Well, there were several reasons for this. First of all, we couldn't come to consensus on which items or recommendations are mandatory versus which are optional or just recommended, right? None are really optional. They're all recommended because as people who do systematic reviews or use them, that we think they're really important. Now, some are really, really important. Maybe some you have a little bit more wiggle room on, but it was too lengthy and difficult a discussion to accommodate an already extremely challenging consensus process, which items must be done versus which items are optional. And for every one person who thought one item was optional, someone else thought it must be done. So he thought the simplest thing at this stage, given the lack of existing guidance, was rather than delay the guidance any longer, was just to cast it as a set of recommendations. And in fact, absolutism was a massive turn-off for the peer reviewers anyway, because if the peer reviewers disagreed that one of our recommendations was something that must be done, they were simply recommending rejection of the manuscript, and we were never going to get it published. It's also important to remember that COSTER is not the product of an organisation like Cochrane, whereas Cochrane can say its members, if they want to publish a Cochrane systematic review, must do something. We're just a set of assembled, not totally randomly assembled, but we're just a group of informed people with an opinion about how systematic reviews should be done. We can't tell people what to do, and we can't enforce the standard ourselves. All we can do is say that we recommend such and such be done. Now, it'd be really nice, I think, if in future there was some way of distinguishing between the compulsory and the optional section of systematic review, but right now that's probably not where we are as a research community in the environmental health area. The point really is to be accountable and transparent. So if someone hasn't followed a recommendation for COSTER, one should ask why, because there are good reasons for every recommendation. And if you don't want to follow a recommendation, you should explain why, because you might have a good reason for not doing so, and that is also a perfectly valid and useful thing to do. And of course, a user of COSTER, so if you're a research commissioner or an editor or whatever, you can make certain elements mandatory if you want. For example, at Environment International, we require risk of bias in systematic reviews, and we recommend a domain-based approach to doing this. And this is something that the user of a standard can implement, which maybe the writers of the standard, who might be restricted to recommendations, would not be able to do. So to summarise, it followed, I hope, and my fellow authors hope, that COSTER should help researchers conduct a useful, transparent and credible systematic review of environmental health research. It's not perfect. COSTER can and will be improved over time as our methods for conducting environmental health systematic reviews improve, community views on which methods are a bare minimum for robust systematic review develop, and our ability to capture the community views on what ought and must be done in a consensus process also evolve. It is still the most comprehensive, explicit guidance for environmental health systematic reviews that is available, and it exceeds current practice in most systematic review publications. Successfully following COSTER should result in a better systematic review project. With that, I would like to thank you all for listening and invite questions.